Welcome back. I'm glad you're still with us here on Morning at NTV. We are going to be taking note of the burden of congenital heart disease among children in the country. I have with me two health experts who are going to be helping us understand what is the state of affairs, but most importantly, what should be done to halt or to attend to what could be a very grim spectre. But before I introduce them, congenital heart disease, or CHD, is the most prevalent congenital abnormality and a leading cause of childhood mortality. The estimated prevalence of CHD is 8 to 12 out of every 1,000 live births, and unrepaired congenital heart disease is a major cause of heart failure among children in Africa. This conversation will be, of course, emboldened by Dr. Peter Lwabi, the Deputy Executive Director at the Uganda Heart Institute, as well as Dr. Sulaiman Lubega, a Senior Consultant Pediatric Cardiologist. Gentlemen, welcome to the program.
Thank you. Good morning, viewers.
Thank you. Good morning, viewers.
Let me start with the Uganda Heart Institute, and specifically in addressing cardiovascular diseases in the country. First, bring us up to speed with where we are, but most importantly, the work and what the Uganda Heart Institute is.
Okay, thank you once again, and thank you for having me here. The Uganda Heart Institute has been in existence by an Act of Parliament enacted in 2016.
Okay.
And it addresses the burden of cardiovascular disease. We look at clinical care, we look at training, we look at research, and also we advise government on policy. Now, cardiovascular diseases is part of what we call the NCDs, non-communicable disease, which we know are one of the leading causes of mortality worldwide. We know that every year over 47 million people die of these conditions. These include heart disease, they include diabetes, they include sickle cell, they include cancer. Now, in Uganda we know that 1 in every 4 adults has high blood pressure.
1 in every 4.
Yes. And unfortunately, most of them do not know that they have this condition. So we need really to raise awareness about this big problem. Similarly, in children, as you correctly stated, 1 in every 100 children is born with a heart defect. So in Uganda, where we have an estimated 1.6 to 2 million children being born every year, we have about 16 to 20,000 children every year born with a heart defect. But not all heart defects are very serious. Those that require some intervention, about half of those. Okay. So that would be about 8 to 10,000 born every year who need to be worked on. Okay. So that is the kind of burden of disease we are facing in Uganda.
Specifically, and this question goes to the Senior Consultant Pediatric Cardiologist, Dr. Sulaiman Lubega. What is congenital heart disease, and how common is it among children in the country?
As Dr. Peter has stated, our Deputy Director, congenital heart diseases, the word congenital means someone is born with that abnormality. That's what congenital means. It means you are born with it. The abnormality. So congenital heart disease refers to a condition of a heart disease that you are born with. At the time of birth, you have the problem. So congenital heart diseases are very common, like you said. They occur in about 1 to 100 births. So if you have 100 deliveries, one of them has a congenital heart disease. That's the burden. And these congenital heart diseases are really spread across. Most of the conditions are holes in the heart. Okay. Those are the commonest congenital heart diseases, having holes in the heart. There are multiple holes, but we don't want to dwell into the details of the holes. The ventricular septal defect, atrial septal defects, and other holes. But those are the commonest congenital heart diseases, having holes in the heart. Other abnormalities that people are born with involve blood vessel blockage.
Okay.
Blockage of blood vessels. It could be the blood vessels taking blood to the lungs, which is the pulmonary artery, or taking blood to the whole body, that's the aorta. So those could be blocked. However, also the valves inside the heart could be abnormal. Either they are blocked, they don't allow blood flow into the heart, or they don't close well. Those are the heart valves, in which case they are leaking. So those are the commonest. However, there are many abnormalities and that children could be born with. But commonly, it's usually the holes in the heart and blockage or of blood vessels, or the heart valves not working properly. We know the heart has normally 4 heart chambers, and sometimes because of those abnormalities, some of the heart chambers may not form. Sometimes you have only 2 heart chambers, and yet we know that these heart chambers do different things. On the left side, there is clean blood, which is well oxygenated, and on the right side, there is deoxygenated or dirty blood, what we call dirty blood. So because of these holes and blockages, it interferes with the blood flow, in which case blood which is dirty may go to the left side and be pushed to the body. So you can imagine if blood without oxygen is pushed to the body, where the body requires oxygen, but then the blood pushed has no oxygen. So that causes multiple manifestations of heart disease.
All right, that is a very grim spectre, no doubt. And my fear, and I believe anybody's fear out there, is detection, especially to be able to deal with this. Let me stay with you on this very briefly. How is it, I don't know even how to go about with this question, but, and this is a question that seeks to cater for those that may not be able to access effective health care, to be able to detect this condition, especially upon birth of a child. Talk to us about early detection and how the unexperienced, not knowledgeable person can quickly figure out that the baby has a problem.
Okay, thank you for that wonderful question, which really appeals to all the public, because early detection also is transferred to early treatment.
Early treatment, yeah.
So early detection requires us to look at the symptoms or the things that may manifest. And these include problems of breathing. When we look at the child, you can compare your child to any other child.
That's
or
right.
If you have other children you've delivered before, you look at the breathing. Sometimes people have difficulty in breathing or fast breathing. And sometimes that fast breathing may be associated with chest indrawing. So fast breathing or the chest going in. And mothers who are experienced will detect this, that my child breathes fast. So fast breathing or difficulty in breathing is a key sign. Another sign is blue discoloration, which we call cyanosis. The other dirty blood we talked about, if it goes into the body, instead of the body, especially the lips being pink or the palms being pink, they will appear with a dark hue, which we call cyanosis, a blue discoloration, which is called cyanosis. So that's very important. The other issue is getting tired easily. We know that babies, their main duty, like for example, when they're still very young, is breastfeeding. So it is manifested in breastfeeding. When this child is breastfeeding, they breastfeed for a short time, get off the breast, and get back to the breast again. So they breastfeed multiple times, but each time they get tired easily. So they can't suckle well. And as a result of all these babies, instead of gaining weight as they grow, because babies gain weight rapidly.
That is right.
So instead of gaining weight, they lose weight or they don't put on any weight. So that failure to gain weight or put on weight or lose weight is a key factor in this. Another manifestation may be body swelling, but this is not so common when the children are very young. The body swelling, babies tend to be shabby. They're big, so it may not be easy. But as they grow up, then this body swelling may easily be picked. The other thing is when you look in the chest of the child, the child, it should be silent, sort of silent. But sometimes you'll recognize that it is very active. We call it the precordium, especially on the left, because usually the heart is manifested is on the left side. So sometimes that part is very, very active. So those are very, very key things for us to peak, especially in the community, because I'm now talking about the community. When they come to the hospital, the other things we may look at.
You're well versed in the very technical aspects and to look at the details.
But also things like excessive sweating. You recognize the child is sweating, even in the cold, when it's raining, like now it's a rain season, but then you recognize that the child is sweating a lot, even with a mild exertion, doing very small things. They're excessively sweating. So those are really...
Dr. Lwabi, the Uganda Heart Institute is at the forefront of managing these and very many other conditions related to your expertise and mandate. Take us through how the management, I don't know how to, I'm still thinking about some of the things that Dr. Lubega revealed, and how you're supposed to be monitoring a child. And many times if you're a parent, it becomes very apparent that you have to pay special attention to very small details. But take us through the management of congenital heart disease, but also the treatment options that are available and what roles parents and communities play in this.
Okay, thank you. Once again, the most important thing with congenital heart disease is the early detection. Early detection. So once the parents notice that there's something wrong, they should seek to get the children checked. And so we have various modalities for checking the heart that will confirm the diagnosis. They include X-rays, and we have some other machines, special machines that can scan the heart, and they are very accurate. Up to 90% of all these can just be accurately diagnosed with what we call the echocardiogram. It's a special ultrasound of the heart. Now, once that is done, then there are options to treat these children, including what we call surgery. And there are two types of surgery. One is what we call open heart surgery. That's the most complicated type, where we have to stop the heart and put the patient on an artificial lung and then do the operation. Then the other one is called closed heart surgery, where we don't stop the heart. And we have a special theater called the cath lab theater, which Dr. Lubega actually heads, and you can close certain holes and defects in that theater. Fortunately, both these services are available at the Heart Institute. And then there are other conditions which can be medically treated, like infections of the heart, where we give you certain medications that actually can be used to treat heart failure. And then finally, obviously, the important thing is emphasis on a healthy lifestyle. So we have to pass these messages out, and it's not only to adults, but good health or bad health actually starts in childhood. So we also have that important factor of passing on the right messages to the children so that they grow up healthy and avoid other heart diseases in future.
So across the country, how does the Uganda Heart Institute roll out these services, or specifically these facilities, including what you said was the echocardiogram, are only available at the Heart Institute main facility in Mulago, is it?
No, actually, part of our mandate is also to supervise the regional referral hospitals, which are 14. And so we pay a visit to each of these hospitals at least once or twice a year. And during these visits, we actually carry portable machines, and we're able to identify these children and send them to the Heart Institute. But we've gone a step further of trying to make sure that these services can now be established at the regional hospitals. And this has been done by identifying staff in these regional hospitals, get them trained, and then they can go back and work at the hospitals. So far we have Masaka Hospital has a cardiologist, Mbarara also has 2 cardiologists, Jinja, and we also have Gulu. So these are areas now that actually have some staff who have the capacity to make the diagnosis.
Okay.
And so this we hope to roll out to all the other regional referral hospitals in a bid to make sure that we get coverage. It's not easy for all patients to come to the Heart Institute.
I know. And it's important to decentralize cardiac care.
Exactly. So that is our major objective in trying to broaden access to care.
Okay. Now, Dr. Lubega, maybe relatedly to what Dr. Lwabi is talking about, I think the recent conducted patent ductus arteriosus surgical camp in Mbarara was pretty much one of those. I hope I got that pronunciation right.
Yes. Patent ductus arteriosus. PDA.
PDA. Interesting. I wanted to do PDA, then I knew my people out there understand PDA differently, and I had to go straight to
Sure.
So tell us about the camp and what you would share as the success story.
The recently concluded camp was done in Mbarara, in which 12 patients with patent ductus arteriosus were operated. And for the listeners out there, patent ductus arteriosus, that's a hole in the blood vessels, major blood vessels. That's the pulmonary artery, and that's taking blood to the lungs, and the aorta taking blood to the body. Those are the major big vessels. Yeah. So there's a hole at the takeoff of those vessels. So that hole communicates and takes blood. Instead of going to the body, it goes to the blood, to the lungs, and floods the lungs. So it makes the children very sick, have respiratory tract infections and difficulty in breathing, which are the things we talked about. So those camps are done, have been done, initiated. Now we've done Mbarara and Jinja, the PD device closure, PDA, patent ductus arteriosus ligation. Yeah. So that is done with surgery, and that is called closed heart surgery. Remember, Dr. Lwabi talked about open heart surgery, where we go in and cut the heart open and go inside. But closed heart surgery, it means when we go inside the chest and reach the heart, we don't open the heart itself. So here they're able to turn that duct. Duct is a small tube connecting the two vessels. So they're able to ligate it, to tie it. So our surgeons, as part of the extension of services outside Uganda Heart Institute, which Dr. Lwabi was talking about, we are now going to regional hospitals to begin doing the surgeries there in the communities where the patients come from. As you're aware, coming is not easy. So the teams on the ground help us to screen the patients. Because in Mbarara, we have a pediatric cardiologist, Dr. Dora, who is there, helps us to screen the patients. When we go back, we look again at the patients and assess other features of suitability for the procedures. And all patients who were operated were successful. They all recovered, and they are doing very, very well. Wow. Of course, the good thing is, in case of any challenges, patients not being operated because of some other reasons, we're able to transfer them to Uganda Heart Institute. But that camp and the ones who've carried in Jinja have been very successful, and the community, they've been well received. And what Dr. Lwabi could have not told you is that as we speak now, in Mbarara, we've been allocated land to construct Uganda Heart Institute branch. So that our presence is all the time, not these visits that we go to regional centers. And that's because of these activities which are ongoing. Our presence is being felt and appreciated. So that's how we are doing so.
Lovely. You've helped answer a question that was going to be our last, but allow me just ask you very briefly before I come to Dr. Lwabi to wrap this conversation up about the misconceptions that you commonly encounter when dealing with this condition, especially within communities. There are people who do not believe that this problem is actually one that has been occasioned upon a child, upon birth, and they conveniently know, according to them, that it's the work of some other powers.
Thank you for that wonderful question. Misconceptions are really, and in the African culture,
that's right.
I think these beliefs and misconceptions are common. One, we need to recognize that congenital heart disease, the causes are, by and large, not known. The causes, by and large, are not known. And anything which is known leaves a gap for suspicion. If you don't know something, it's not clear. It's a reason for you to think widely, as wide as you can be. So it leads to superstition. People thinking about maybe witchcraft. People actually even go to pray We have people who, when they get these problems, they go to church, they think they can be solved in churches. And after praying, they come and say, check my heart, the child's heart, to see if the child heart cured. So we have that category who go to church. And of course, it's good to pray, because the prayers will guide the health workers to probably treat your child better. Okay? So there is that. But there is also, I think, an issue we cannot skip. These fathers who always think that it's a problem of the waves. That when they deliver a child with a heart problem, they say that on our side we don't have any heart problems. It's a problem of mothers. And that leads to abandonment. So quite often these children are abandoned. The mothers struggle alone because the fathers think it's not their responsibility. And yet, like we say, these come up as a process of the formation of the child, and that's a lengthy science.
Very lengthy indeed, no doubt. Dr. Lwabi, wrap this up. On price, are some of these services free? Heart surgeries, we hear, are really expensive sometimes, and fundraisings are done. Please debunk what can be debunked and make clear what should be clear. Okay.
First of all, it's true. Heart services are not cheap. They're expensive, and someone has to pay. The fortunate thing, we get a lot of support from the government, and this enables us to offer subsidized services. On average, cost of an open heart operation is about $5,000, or about 18 million. That's a lot of money, even for any of us. Getting it out of pocket is expensive. Right, But having said that, no patient is turned away. We have waiver mechanisms, we have support mechanisms, and we encourage patients just to be owners of the treatment process, and that helps and goes a long way in making sure that every patient is attended to.
Care of. Dr. Peter Lwabi, Deputy Executive Director at Uganda Heart Institute, and Dr. Sulaiman Lubega, Senior Consultant Pediatric Cardiologist, many thanks for sharing, and of course the insight and perspective has pretty much helped inform some of the decisions that will be made by anybody out there who could be in this situation. We do hope that you seek the services as they are available, especially at the Uganda Heart Institute. That will do it for the conversation, and indeed, Morning at NTV. This 26th day of November, it's been a pleasure having your company. I'll see you tomorrow. Have yourselves a lovely day.
Thank you.